All right, we welcome you back. Pregnancy can be stressful for many women, and for women who have heart conditions, there is an added layer of worry.
In this morning's STL Moms Report, Fox 2's Molly Rose talks to a doctor who says there are steps women with heart conditions need to take before even trying to get pregnant. Molly?
Yeah, John and Randy, during pregnancy, your body makes more blood for your growing baby, so this means everything has to work a bit harder, and it does put an additional strain on a woman's body. So we are learning more this morning from Dr. Gary Dildy with SSM Health. Doctor, thank you for being with us.
Good morning, Molly. It's a pleasure to be here.
Can you talk to us about these conditions? Is it safe for a woman with a pre-existing heart condition to still get pregnant and have a baby?
It can be safe. Certainly, there are many different heart conditions that exist. Some are more mild and others are more severe. More severe cases, we have to consider very carefully what the risks to the mother and the baby would be with a future conception. That's why it's just very, very important for a woman who's considering having a baby and who has a congenital heart condition to find a good obstetrical care provider who can then refer the mom or prospective mom to a cardiologist to make sure we know where we are with cardiac status. And it would be also a good idea to have a preconception or before pregnancy consultation with a maternal fetal medicine specialist to integrate the information from the cardiologist into the obstetrical side of things, and thus determine are we at an optimal point of managing the condition. For example, if there's some element of heart failure, can that be improved? Or if there's hypertension, high blood pressure, can we get that better controlled? And then in many cases, women are on medications that may not be compatible with pregnancy, including some blood thinners and some high blood pressure medicines, like, for example, ACE inhibitors, where we want to change those medicines before they conceive so that it reduces the risk of the baby having certain risk for birth defects. So there's a lot of decisions that in coordination that should take place before pregnancy. And that can very much improve the chances of a high-risk patient to conceive. And for many women, it will also give them peace of mind that pregnancy is something that they can do safely. During the pregnancy, there's monitoring, special monitoring we do, besides just that of the routine obstetrical care, to make sure baby's growing well, that mom's not developing any problems. We may, for those women who have congenital heart disease, they're going to be at greater risk for a baby that has congenital heart defects. So we very often will do a special fetal heart ultrasound or echocardiogram during the middle trimester. That's something that's not routinely done otherwise. And then, of course, a lot of the changes that take place and a lot of the risks that occur during the labor and delivery period, and that's where specific plans are made in advance so that the entire delivery team, including the anesthesiologist and the nurses and the obstetrical providers, have a coordinated plan to watch out for specific problems and to make sure mom and baby deliver as safely as possible. And then last but not least, people tend to forget once the baby's delivered, they start focusing on the baby, but the postpartum period after the 6 or 8 weeks after delivery is also a dangerous period of time for many women with congenital heart disease. They may be at risk for blood clotting disorders and other problems such as heart failure or uncontrolled high blood pressure.
We want to thank you so much for all this information. Unfortunately, we're out of time here, but you provided so much to our viewers. We appreciate it. I hope you have a great day. Thank you for joining us.